Hi, it's Dr. Centeno. What do you do if you live in Europe and you think you have craniocervical instability? First, I want you to like, comment, share, and subscribe because that's how we get this information out to more patients like you. So we have many European CCI patients, and for example, this last week I had a patient each from Poland, Ireland, and Germany. And what are some of the challenges that these European CCI patients face? So there are three problems that I see for most European CCI patients. One is imaging, the other is finding upper cervical chiropractors, and the other is travel. So imaging in Europe, DMX is not available. Upright MRI is available, but many times it doesn't include flexion and extension views. So if you get that, make sure that's included. And oftentimes we'll get a rotational CT scan, which really doesn't count, in my opinion, as determining if you have CCI. So how do you solve this? Well, we can give you an X-ray protocol to try to get the specific views you need to replicate what a DMX would do. If you get an upright MRI, obviously make sure it has flexion and extension views. And I would not bother with getting a rotational CT. The reason why you really don't need a rotational CT is that the rotational CT studies out there really don't show as positive for the vast majority of patients who have CCI that get them. And the surgeons that I see that are using this metric are, in my opinion, are really using a very flawed version or subversion of this maximum. On upper cervical chiropractors, there are a handful in Europe. I can highly recommend Dr. Ian Smith. We've worked with him before. You may find others. On travel, flying to the US may seem daunting, but it's actually pretty simple. Most countries don't need a visa at all. If you need a visa, it's called a B2 visa. We can give you a letter from our office saying that you need to come to the US for specialized medical care. And Denver has lots of direct flights from all over Europe, including London, Paris, Frankfurt, etc. So in summary, we can usually overcome the imaging issues. You may need to get a DMX when you get here, that's possible. You may need to travel to the UK to get upper cervical chiropractic care, but it's not required. So make sure you understand that, meaning I'm not requiring my patients to be with an upper cervical chiropractor once they get back home. And travel is far easier than you think. So like, comment, share, and subscribe because that's how we get this message out to more patients like you. Thanks so much and have a great day.